Insurance is not an investment. The more you pay, the more risk has been transferred to the insurance company. The odds are in their favor. That's how it works. Welcome to How to Retire on Time, a show that answers your retirement questions. We're here to move past that oversimplified advice you've heard hundreds of times. Instead, we're going to get into the nitty-gritty here, have some fun. As always, text your questions to 913-363-1234. And remember, this is just a show, not financial advice. David, what do we got today?
Hey, Mike, which is better, traditional Medicare, Medigap plans, or Advantage plans?
So I've got my opinion, but what's your opinion? Because you are the director of healthcare.
I am, yes.
You're kinder than I am on these things, but I mean, what's your take on this?
Yeah, there's no one answer that is correct that's going to fit for everybody. And I know you've said this on the show about, finances.
There's no such thing as a perfect investment product or strategy.
Yeah, that's right. And that actually applies to this as well. There are lots of questions that we would ask that would help us guide you to one of these three paths.
Here's the pattern I've noticed, and I'm curious to get your take on this. I know we talk about this over and over internally, but just for conversation's sake, I have found traditional Medicare on its own is fine. It's not really good or bad. It's just fine. Mm-hmm. If you're healthy, it's great. If you're healthy and just want maybe dental or extra things, the Advantage plans can work. But it's as long as you're healthy. Mm-hmm. If you're not healthy, or you have maybe, you didn't win the lottery when it comes to genetics, you've got a lot of family history, a lot of heart disease, a lot of potential strokes or whatever it might be.
Yeah.
Medigap plans can hedge the risk. Insurance is not an investment, but it's understanding which risks you want to get rid of and which risks you're okay taking.
Yeah.
I mean, it's like, I don't want to go down a rabbit hole of Affordable Care Act insurance or private insurance, before senior healthcare benefits, but healthier people that can take on more risk and maybe want to reallocate their funds to be used for other types of insurance, Advantage might be great. But for the unhealthy, I'd hate to be unhealthy going to the hospital over and over again on an Advantage plan. That's my opinion. I mean, what's your take on this?
Yeah, you're definitely going to be subject to more out-of-pocket costs with a lot of Advantage plans, because I mean they do have a maximum out-of-pocket, but it's generally much higher than if you had a supplement.
But that doesn't cover everything.
Yeah, it might not. You're subject to whatever the plan will allow to be covered, right? And so you don't ever really quite know exactly for sure what that is either until you get there.
And healthcare costs continue to go up, which puts more pressure on these plans.
Yes.
And so if you can afford it and you have less healthy heritage, or maybe you've experienced, when you're 65 years old, you cannot be denied from a Medigap plan or a supplemental plan, right?
Yeah. So when you're initially going into Medicare at 65 or whenever your initial enrollment period is, it's a guaranteed issue, right? So
even at 70 years old, you're leaving private insurance, you're retiring then, you can get in there, cannot be denied.
That's exactly right. But if you've already been in Medicare for a while and maybe you've had Advantage and you want to switch to a supplement plan with original Medicare, you'll be subject to underwriting. That is true.
You got to pass.
Yeah, you got to pass. So that, that's going to be different for everybody. You might have a health history of bad stuff going on.
Yeah. So when you read those articles online, everyone should do X, Y, Z. Just know that's a bad opinion.
Yeah.
In our opinion.
Agreed. And then there's do you like a buffet one-stop shopping? Do you want all of your dental and hearing and vision and healthcare all in one package? Mm-hmm. Then probably an Advantage plan will help you, or could be not guaranteed, but could be right for you.
Yeah. Well, and this gets tricky too, because if you travel, not all Advantage plans. I can't think of a single Advantage plan that's going to cover you overseas if you got sick over there and had to come back. And so there's a lot of nuance when it comes to your lifestyle expectations.
That's right.
And your healthcare risks.
If you are traveling a lot, then original Medicare with a supplement is better because there's no network that you're tied to. You can go anywhere that accepts Medicare.
Yeah, so there's a lot to consider, but I think the takeaway is, which is better? What's your health like?
Yeah.
What's your family history like?
Yes.
What do you expect to do? And that's another Advantage plans to travel. There's a lot to consider here, and let's not dive into those oversimplified, I guess, opinions.
Sure. mean, also, what's your budget? Because you will have to pay. Everybody pays the same for Part B, right? Every person that's on Medicare, they pay that Part B premium.
Yeah, Part B is Medicare, not to
Mhm.
be confused with Plan
Yes,
A, B, C, D, E, F, G, X, Y.
exactly right. Yes, there's so many.
Plans are Medigap.
Hmm.
Parts are Medicare.
Yes. So when everybody pays that, no matter if you're on Advantage or Original Medicare, everybody will pay that Part B, right? And then on top of that, you have to pay if you're going to do a supplement plan, you have to pay that premium. And then if you want dental and health, like all these premiums start stacking up on top of each other.
Mm-hmm.
And so if you can afford that, and it gives you and it fits your lifestyle, then go for it. But
Now,
some people might
couldn't
not
you
be able
just
to.
go direct carrier? So, like, let's say you do a Medigap plan or traditional Medicare,
Mm-hmm.
doesn't cover dental, but couldn't you just contact a local dentist? I guess your wife's a dentist. Maybe you'd
Yeah.
I mean, I think if you just want your basic checkups,
Mm-hmm.
you could just pay cash,
You could.
and they're probably happier to get cash than to deal with insurance companies.
Yes, dental practices do have their own sort of standard rates, right? And they might have a discount for cash paying people, and just skip the insurance companies altogether, which is easier. I can say from experience.
And then you've got these other ministries. So
Mhm.
this is not insurance, but something that can be considered because it's not a part of the question. They probably didn't even know they could ask this question.
Right?
The one I'm thinking of is like health. Is it healthcare ministries?
Is it like Christian healthcare ministries?
Yeah, whatever that one is. It's not
Yeah.
traditional health, but like they, and I don't know if we're not representing them quite
No.
well here, but is that do they do dental too and other things,
I think if I remember right,
or is that just health?
it could be just health. I'm not sure about dental. We could look it up and put something in the show notes. But yeah, you're basically you're paying cash to the healthcare provider, and then you submit your receipt to this group, and they reimburse you. And
Yeah.
there's a formula. And
There's other out of the box ways that you can plan for healthcare, for dental, vision, and just other potential needs. And it all comes down to a simple cash break even analysis. Insurance is not an investment. The more you pay, the more risk has been transferred to the insurance company.
yeah,
The odds are in their favor. That's how it works. As Americans, we're getting sicker earlier, and we're getting sicker longer than ever before because we keep living. So expect healthcare costs to continue to go up. But all that said, I would invite people to do some due diligence
yeah.
and to figure out what is right for you, and to try and work with someone that maybe isn't on a commission. You're not on a commission
I'm not.
schedule when it comes to our healthcare.
Yes. There is that danger, and we don't want to cast a wide net over all agents out there, right? That they're all just pointing you towards the plan that gives them the greatest commission.
No.
But it
They're
is a
good
possibility.
people
Yes.
doing their best,
Yes.
but the commission may skew. It's not like more commission or less commission when it comes to Advantage plans. It's all this. It's all the standardized bit,
Yeah.
but it's either does it pay a commission or does it not pay a commission,
Yes.
and that may skew some things. Many people don't know or realize that could exist.
It could.
So, do your research. Don't assume those are the three options. You can blend things.
Yeah. And if you want to walk through it with us, we're happy to walk through it with you.